Hi, I'm Dr. Michael Codsi. I'm an orthopedic surgeon here at EvergreenHealth Orthopedic and Sports Care. My specialty is shoulder surgery and any disorder of the shoulder. I treat people who are pediatric patients, young patients from as old as 1 year old up to 100 to 99 years old. The most common injuries that I see are either arthritis of the shoulder or a problem with the tendons or ligaments in your shoulder. Every once in a while, someone might have a broken bone as well from some sort of trauma, falls, or doing sporting activities and having an injury that caused sudden pain. The other common category or most common reason that I see a patient for is because as we get older, our tendons, our joints tend to start to wear out and they can cause pain. And so that's what usually brings most patients in to see me, because they're in pain and they need some help. In the beginning, most of the treatments I have to offer patients are things that don't involve surgery. And I'd say probably, a good 70 to 80% of people can get better without any surgery. And I think most patients, when I see them for the first time, kind of express a nice sigh of relief when they find out that the first treatment option I'm going to offer them is not surgery. My job is to take all the stress and all the complicated part of their problem and have me take that burden and have the patient just worry about getting better. The hardest part about my job is that I see people every day who are suffering. And it is sometimes hard because we can't immediately relieve that pain. I can't just give you a prescription or give you a pill that just, boom, it's gone. Sometimes we have to go through a lengthy treatment process. Sometimes it involves surgery. But the exciting thing is the promise that down the road we will be able to get that pain and suffering to go away. Most of the surgeries I do are arthroscopic shoulder surgeries, and that is a minimally invasive surgery where we use a very small camera so we can look at all the tendons, the ligaments, the joints of the shoulder through very small incisions. And this has been a huge breakthrough in orthopedic surgery because it really makes the recovery much easier for patients who have to go through big surgeries. Another type of surgery that we do is a more traditional type of surgery where we have to make a bigger incision. And most of the type of surgery is a joint replacement, where you can't do that with just a little tiny incision. The good news is that those incisions have gotten smaller and smaller over time, so the recovery for patients has gotten easier and easier. I chose Evergreen Health because I thought it was simply the best place for patients to get care in the whole state. I've gone through many years of training so that I can be an expert in what I do, and I'm going to treat you like you're my mom or you're my family member. I'm going to try and make this process as easy as possible, and it starts from the very first moment that we pick up the phone to answer your phone call for you to make an appointment with us. And our job is to try and make it as easy as possible. The most satisfying part of my job is usually the last patient visit. When they come in and they can raise their arm up in the air and go, "Look at this, doc, I love it. I can sleep at night. I can throw a ball with my grandson or my kids." There's nothing better than having a patient come back to you after they've gone through a big surgery and they just go, I just want to make sure you understand what you've done. You've really given my life back. I mean, every time you hear it, you feel great about that. I mean, that's what it's all about.